Hey guys, welcome back to another episode of the Altmed podcast. My name is Andrew Dowling, for those who don't know, and with me as always is Mitchell Kurtz, my co-host. G'day, Mitch.
Hello.
And very special guest today. We have a nurse practitioner by the name of Olga Lutzko, who is donning her Geelong Cat scarf. I don't know when this episode is going to be released, but for those who don't know, spoiler alert, the Cats won the 2022 grand final. So go Cats. Olga, welcome to the show.
Thank you very much.
Look, I'm sure you and I could spend an hour just talking about the Cats, but let's talk about medical cannabis, because you are a specialist, and actually even among nurse practitioners that prescribe, I would say that given your qualifications and credentials, you would be one of the more knowledgeable nurse practitioners. So we're very glad to have you on. Perhaps before we talk about your clinical practice and some of the conditions that you treat with medical cannabis, can you maybe just give us a bit of background and how you got into medical cannabis and what your journey's been like to date?
Okay, I got into it about 2.5 years ago when my youngest was needing MC for her health conditions, mainly endometriosis and chronic fatigue. And then another one had severe arthritis from having a bike accident where her ankle was gone, and then that was rebuilt, but then now she has severe arthritis, so that's the reason. And actually one of the companies actually approached me and said how interested I was in medicinal cannabis, and I said I am, but I don't know how to do it. So then they directed me into doing so many courses, and then over the 2.5 years I've done more courses than you can think of. And yeah, my interest is still there and it's still going strong. My other specialty is diabetes. So having clients that have diabetes going on to medicinal cannabis is another notch in my cap when it comes to helping our clients.
No, amazing. Well, I mean, it often comes through on our podcast that often it is through the personal connection, either through friends or family, that the people first come to learn about medical cannabis. But I think in a weird way, the dam wall seems to be broken. I don't know if you've seen this week, Olga, particularly, but there's just been a flurry of news articles, throughout the so-called mainstream media. And I mean, people are now, journalists everywhere seem to be talking about the different facets of the industry, and it really has crossed over into mainstream now. So I sort of think that where it was originally on the fringes, something that people would access through friends and family, word of mouth, it's now gone mainstream. It's not cool anymore, obviously, but no, I wanted to pick up on your special interest of diabetes and treating it with medical cannabis. So can you maybe just, for those who don't know about the disease diabetes, give a background as to what that is, and then we can maybe talk a little bit about how medical cannabis might be a treatment for diabetes.
Okay, so diabetes type 1, that's when your immune system's shot, and basically their pancreas doesn't work anymore, so they have to take insulin 4 times a day, 5 times, 6 times a day, depends on how their eating habits, what their carbs like, what their exercise is like, while type 2 is more an inherited disease mainly from not eating correctly, not moving correctly, and sometimes it's inheritance. It's already in the genetic makeup. They're going to get it eventually. So those guys are 2. You've got those type 2s that can be on diet, oral or injectables, so it varies. But how medicinal cannabis actually helps is it actually starts to lower the blood sugar levels, and then it basically, those type 1s are using less insulin and the type 2s are getting more movement and less medication if need to be. So overall, I've got quite a few examples where the clients are getting a lot benefit just being diabetic using medicinal cannabis. And they're usually mainly using the medicinal cannabis due to being suffering from chronic pain or anxiety or PTSD. But on the other cohort is that them being a diabetic actually helps their sugars too. So they get the best of both worlds.
Yeah, we see this quite often where people come on to medical cannabis for, as you said, pain or potentially anxiety, and they find that they have, I've actually noticed that this symptom from something else is being improved. Or we hear that a lot with, say, female reproductive issues, that maybe somebody comes on to with because they're trying to sleep better, and they realize, I'm getting less, menstrual cramps or something like that. And they don't know why at first. And then they kind of realize there might be a link there, which makes sense. Is that what you're finding kind of with diabetes as well?
Exactly the same, Mitch, exactly the same, that they weren't really expecting anything to occur with their diabetes. But then they come to me and they go, well, actually, my diabetes is best that it's ever been. And I just laugh and go, well, you realize that you're taking medicinal cannabis, even though you're not taking it directly for diabetes, it's actually helping it out.
So, okay. And what does that mean in terms of quality of life for those people?
Longer, a lot longer and a lot easier. They're not having to, like my type 1s are not having to give so much insulin more regularly. The type 2s are the same. They're not having to use medication or injectables as much as what they were previously.
Okay. So is type 1 something that you're born with? Or,
exactly. That's the juvenile diabetes. But you've got to remember the type 1 ranges from birth up until 55 years of age for diagnosis.
Oh, wow. Okay.
Yeah. So they've extended that.
And so do we have any idea, and I know that there's so much research that's going on into every facet of conditions that medical cannabis can be used to treat and the different cannabinoids within medicinal cannabis. But I'm just curious, do you have any idea of what it is that's, is it a CBD oil or dominant oil or a THC dominant flower?
Both. Anyone. They're both. It just depends on what the client is using the MC for initially.
Okay. And do we have any idea how these medicines are sort of interacting with insulin production and levels or anything like this?
It doesn't interact. These guys don't interact, but somehow in the bloodstream, because remember, you're taking medicinal cannabis, it's going through the bloodstream. And remember, diabetes is the same. That's where your insulin sits. So that connection is where it must help the ability to lower the blood sugars.
Yeah, it's fascinating. I mean, just hearing you talk initially about how, and I'd heard about before, people with type 1 needing to obviously, it's kind of standard for most patients, I imagine, to have multiple injections every day,
or their pumps or their whatever they're using.
And to have that flow-on effect where you're reducing the number of times that they would need to do that just through, I guess a byproduct of their medical cannabis use is fascinating to me.
Very much so.
It's
excellent.
Well, it makes sense when you think about cannabinoids restoring homeostasis to the body. It's interesting. I was having this discussion with somebody else the other day about whether the medical cannabis use is kind of equivalent, but maybe minus the side effects of treatments that are otherwise available, or if the type of treatment that's occurring through medical cannabis is unique and that you can't get that type of relief from another source. So for example, when we think about, back pain, you may get relief from CBD oil or THC, but you could potentially get that relief from Nurofen, let's say, or in some kind of fibromyalgia situations, you're not really getting that relief from paracetamol or even stronger opiates, but you are getting that relief from medical cannabis. So you can't really compare the two. And how does that kind of sit with diabetes? Is it the kind of thing where there's an equivalent remedy, or is it something that's kind of unique?
It's very unique, Mitch, very unique. And it depends on, like in diabetes, they're using a variety of insulins, they're using a variety of medication. So we don't know enough how that interacts with which medicinal cannabis they may be on, because you've got the terpenes, you've got the flavonoids, you've got, the CBD isolates, you've got the broad spectrums, all those. We don't know which one's going to react, but it's just an individual thing and it works.
So it's a process of trial and error with a lot of the patients.
But that's, you find that with anything though, Mitch, it's trial and error.
Yeah, of course. Do you find that though there are certain product formats you tend to reach the prescription pad for more than others?
In the CBD range or in the THC range?
Either or, in general, just things. What are you normally writing scripts for?
It will depend on the client and the costs to the client.
Yeah, okay.
Mainly. That's my first thing, because some will say, I can't afford it. And I've gone, oh, you're kind of in an area where you need to kind of afford to be on medicinal cannabis because you can't get it for nothing.
Yeah, of course.
And so it'll depend on them. But then some of them come to me and they know about certain flavonoids, they'll know certain isolates, they'll know. There's quite a few that will walk in and say, I want this one. And I've gone, how do you know this one's different from another? Oh, I've done my research. So then and that usually backfires on them because they don't know enough.
Yeah. And so they've just sat on Reddit for a few minutes and
gotcha. That's the main one I'm finding out, that thing. And I've never been on it and I don't want to, because that's not my area that I want to go and find out, because I know the companies, the products and what's in them. That's all I care about.
Yeah, of course. I guess from the patient's perspective, they don't have visibility over that. So their only outlet is to sit on Reddit, which is a series of forums where they can discuss their experiences between each other and confer and say,
but everyone's an individual though, Mitch. It's not going to help, because someone's saying, oh, this one's better over another one. Well, how do you determine that? Because you don't know your body until you actually try it.
Yeah, of course. I guess it's the Australian equivalent of Leafly, where that people review their experience. It's a Trustpilot, or if you will, a Google reviews.
Well, and it's a consequence of, I guess, every bit of information being behind a barrier, in the sense of, you're meant to see a healthcare professional, you discuss your particular circumstances and your personalized treatment with them. But unlike America, we don't have any sort of direct to consumer advertising of products or anything like this. So there's pros and cons, but I certainly see that the result of that is you have, hundreds of thousands of patients in Australia who regularly use medical cannabis, thinking, where do I go to talk with other people who are being prescribed flower and oil and share my story and what I think is good and what didn't work for me. And so you have all these Reddit forums and, Facebook groups, and it's quite an interesting place. And, I
wanted to touch real quickly on something. Actually, we were lucky enough to have Simone O'Brien on the show,
which was colleague,
which was beautiful. And I very much wanted to ask you a similar question that we asked her about the difference between seeing a nurse practitioner and a doctor. Now, I know there's one obvious downfall, which we can talk about, but in my opinion, the nurse practitioner has, coming from a nursing background, has a very different interaction with the patient. They have a whole different take on patient care. And I'd love to get a little bit of your insight on that, and then also how that applies in cannabis after we talk about the one downside, which we haven't actually done on the show yet. We didn't bring it up last time, but yeah, I'll leave it with you.
Okay, easy. Basically, the one downfall is nurses can't be authorised prescribers. TGA will not allow us. I got there to the last resort that one of the companies had put the applications in, went to the ethical committee, they approved it, and then TGA said no, because in the wording, it only says medicinal cannabis prescribers have to be medical practitioners only. So therefore, we can't do it. On the onset is that nurses listen to clients. We listen to what they want. We listen and then advise, oh, this is ways you can do it. I then say, well, what would you like? Do you know any difference? Like if they're used to smoke dope or anything, do you want firstly an oil, which I always recommend, and then have the dried herbs, whatever. But I listen. I don't make the choice. I do it as a consult together with the client. I don't say, well, no, you have to go on this one, and that's the only one you're going to ever go on. I make it so that it's their choice in the end. And then I always make them aware that if one doesn't work, there's plenty out in our area that will work for them.
And do you find that a lot? Do you see people try something, doesn't work, and then they do try something else and it does?
Yes, very much so, Mitch. Very much so. I have got probably half of my clients. There will be one that they're either adamant they want to try and then they go, well, this was useless, or they've heard that so-and-so uses this one and I'm going to try that one. And I've gone, that's not going to work in your situation. But if that's what you want me to do, I will get that approval and I will get the script down for you. And then they'll be calling me going, it didn't work.
So I imagine that it would happen the other way sometimes as well, where somebody would be on something that does work and then they decide they want to try something and then it doesn't. And then like, oh, I shouldn't have done that.
Yeah. And they'll go back to whatever they wanted. It could be that a specific combination is better, or some are better off with, say, a CBD and a THC, or the combination. It just depends on the person, what they want to get, what the ailments are, how they feel. Taste can be a massive issue. I've got clients that go, I'm not going to have that ever again. It was revolting. I was going to be sick after having it. So that's another issue too, that a lot of my clients go, no, don't. There's certain companies that the taste is revolting.
So what about, just curious, do we know the reason why the TGA won't allow nurse practitioners to be authorized prescribers?
Easy. It's in their wording, in their documents, that was done years and years ago, and they have not changed it. Right. Until they change it, and the pressure comes from companies and like associations like the UIC, all those areas, until that is pushed, they're not going to change. And they told me, they wrote a big nice email, yes, everything is up to it, but the wording of the TGA, until they change it, the same as the driving laws, until Vic Roads change it, we can't drive with THC in us.
So a nurse practitioner is not considered a medical practitioner?
No, according to TGA, we're not, even though we are a prescriber. Okay. Okay. So Mitch, the difference is APRA sees us as a prescriber to do anything. However, TGA say, no, in your thing, you can't, you can do it through the SASBs, but you can't do it through an authorised prescriber.
Is that the same with other drugs?
No, hang on. Yes, there is, because in diabetes land, for type 2 diabetics, when they're on the basic oral medication, I can prescribe it. But as soon as they go into different sections like our SGLT2s or GLP-1s, the doctor has to prescribe first. I can do repeat scripts.
Right.
But then for insulin, I can give a client straight away insulin, which can kill them, but I can do that. So
yeah. So you got, it's kind of like a restricted capacity
Yes.
prescribing. Yeah. Gotcha.
very
Okay.
much.
Well, and tell me, I do.
Sorry, just to round off on that though, you can do
Okay.
special access scheme applications, or is that only something a doctor
Yeah.
can do?
No, I do those. That's the only way I get it.
That's the way to do it. Yeah.
It's just the time in saying that, Andrew, a doctor can straight away give a script and the client can go to the pharmacy and order it in. While with EMP, we've got to say to the client, well, it can be 24 hours or anything up to 5 business days. Depends on how TGA is busy.
Yeah.
And it's interesting because you're one of the only, I have to say prescribers, don't I? Prescribers I know that actually has studied more formally in the area. I'd love to know more about that. So arguably, there's a case to say that you might even know a bit more than some doctors, but I'll let you speak to that.
I'm going to say, Mitch, don't get me into trouble. But yeah, it's basically because doctors, in saying that in my behalf, doctors might only do 1 or 2 courses that might be half a day to a day course and do short courses.
The CPD collections.
Yeah, that's it. And then they do 5 scripts and they can become automatic authorized prescribers. Well, we can't. So therefore I've gone, right, okay, if I can't do it and I have to prove to TGA and APRA, the nurse's registration or the medical registration, you can call it, basically my ability to be able to do medicinal cannabis prescribing, I wanted to make sure that they can't turn around and say, no, you can't. So then I did my advance, my professional certificate, and then my diploma in medicinal cannabis through Health Cert Queensland University. And yeah, it was actually quite an easy course. It didn't take me long because everything that they were teaching me, I'd already known. I was already doing it already. And it was just making it clarity that I know what I'm doing.
Yeah, amazing. And to be honest, I didn't actually know there were I'd heard about various. I know there are tertiary degrees now in the US and in other parts of the world that.
That's the next one I'll be doing.
Is that the next on your list? Okay.
Yeah, there's one that one of my favorites, GPs in America, and he's going to create one, and that's the one I'm going to do. Oh, Jesus, what is his name? He's a young guy, and I've just got a complete blank, but he is magnificent.
You flying over?
Sorry?
Are you going to fly over and do it, or is it online?
No, it'll be online.
Oh, nice. Oh, I don't know. Well, yeah, can't leave Geelong. You got the Cats to support, I guess. But
yeah. And what would happen in my football season, even if the Cats were terrible last year and next year, I'll be there at a game. So no, Mitch, I'm not doing that. But this course, I think they're developing it with, I don't know which company, but as soon as it's done, that's someone that course is definitely, because I can't remember. He was at UIC and he actually spoke to us. His surname starts with a D, but anyway, he's the one that I'd like to do a course through because he knows what he's talking about. He's a young GP that is on the ball with medicinal cannabis.
Yeah, beautiful. Well, we put you on the spot, so that happens sometimes.
I don't know.
No, that's good. But apart from diabetes, what would you say are the main things people come to you with?
Anxiety, depression, and chronic pain.
Depression as well. We usually hear anxiety, pain, and sleep, but
no depression. No, I get a lot of referrals from psychiatrists that have got maximum dose of these guys on depression medication, and they've asked for me to help analyze, see if these guys would be great candidates for CBD.
Yeah. Yeah,
and
it works, right? In like how often? Out of 100 patients?
I would say about 30.
Oh, 30 out of 100 patients it works? Or
Oh,
you're
no,
saying
it
is,
always works. That's how many, say 30 that would be
uh,
the ones with depression.
oh wow,
and
that's a lot more than I thought.
yeah. Oh yeah, and it does work for them. I've got quite major cases that are quite in the mental health capacity that the psychiatrists have gone, Olga, please help. And I've gone, well, I don't know if I can, but and it works. It's fantastic.
Yeah.
But is this a do you find that, say you've got someone with complex or major depression, is medical cannabis supplementary to their sort of conventional medications, or is this, have you seen instances where people with those conditions have been able to transition eventually to using medical cannabis on its own to treat their condition?
Andrew, in saying that, it depends on the client, depends on their mental health issues. Because if you've got a schizophrenic, you're not going to take them off their medication, but you add CBD and they might lower their dose of their medication. Okay. Manic depression, the same thing. They will still stay on their medication with the additive of the CBD, but their doses have gone down quite drastically.
Oh, that's amazing, isn't it? It's just the sort of the flow on effects. And then in terms of, I suppose, so depression and anxiety, we covered off on.
Schizophrenia is actually an interesting one because it's the one that you've been told your whole life. Medical cannabis or cannabis in general is, you can't have that if you've got a history of that. And then all of a sudden we see it listed, as or at least on some sites, that it has been used or it's been approved by the TGA for treatment of schizophrenia.
It is for only with CBD, no THC. And that is the problem, because in past years people would be smoking dope and then they wonder why they've had manic hallucinations, gone off the edge, and then they go onto CBD and they've gone, I feel great on this, and I'm not having any ulterior thoughts, whatever. They feel good. And I said, yeah, because you're on the wrong thing.
I remember the first time I heard about CBD, I think I was like trying to get my head around it. And somebody explained it to me. Actually, it was my uncle. He goes, the CBD is kind of, in layman's terms, the anti-venom to THC in some respects.
It is.
It's funny though, but it works synergistically, and it does in some instances have a similar outcome in some respects, but it actually reduces the effects of THC. It can kind of counteract things that THC can potentially be anxiety provoking, whereas CBD can reduce that. It's very, it's interesting to see it kind of in that way. I got a guest appearance.
I've got two of them in here. Sorry guys.
It's raining cats and dogs over there.
I was gonna say, I thought she was a cat supporter.
Sorry guys, sorry.
We love a bit of impromptu visits.
Might even leave this one in. Might not even cut it out.
I'm so sorry. Apologies. It's just that I've got two of it. The older one, he'll just stay with me, but the younger one, she'll hear anything and she'll go Burko. But they wore their cat supporters.
It's 2022. If you haven't had a Zoom with somebody's dog featuring on it, then you haven't really done any work, I don't think.
Well, in saying that, Mitch, I've saved a lot of clients who've overdosed on THC or smoked black market weed, and they've gone on to CBD. That has counteracted the effects, and it works a treat. And then anyone that comes to me and go, oh, look, I just want weed because that's what helps me. And I've gone, but your case, you shouldn't even be using any of it. You maybe try a dried herb with just CBD in it, and then have gone, oh yeah, this smells better, and I've gone, yeah, because with your mental status, you shouldn't be having any of the THC.
Yeah.
So just one last one from me. I'm just curious, I alluded earlier to just the flurry of media interest in medical cannabis of late.
I was interviewed, sorry, Andrew, 2 weeks ago by the Geelong Addy.
Yes.
As being the main person. Thank God the reporter that I had, she was brilliant. Main person in Geelong that prescribes it.
Oh, wow. I love that.
So that's how I'm getting more clients anyway, but through the Geelong Addy doing it.
That's fantastic. I love
you might have to explain that to a city slicker like myself, but what's the Geelong Addy?
Sorry, Geelong Advertiser, Mitch.
Geelong Advertiser, like
Sorry.
The Age. Ours is the Geelong Advertiser.
The Gelage.
Yeah. When Mitch and I first became mates 20 years ago, I forgot to share with him my Geelong vernacular. But yeah, the Geelong.
Yeah, you actually did. Look at you in your white shirt now. You're all.
He just needs a bit navy blue and he'll be right.
The Geelong Addy is the major newspaper for Geelong, and I love that they're doing I guess your bidding in sort of putting forward.
They did for me. Basically, 2 weeks ago they put it in a nice whole one page about me and prescribing, and how there's so many doctors out there that are so naive, they don't understand it, or some of the doctors have tendency to prescribe, the real expensive ones that are costing clients $400, $500 a bottle. And I don't do that. I don't see the point. There's no difference between a realistic, better product, cheaper price to compare to one that's like, can I mention companies' names?
No, don't do that, please. Just
but
you can say price points, but
yeah,
we'll
for their
leave the
price point of $400 to $500 a bottle, it's unrealistic. We can't afford that. People can't, because remember, medicinal cannabis is their last resort before they go on to my next therapy that I'm being trained in. And
go on.
And LSD.
Yeah, psychedelic medicines. No,
yes.
Although
thanks to Simone, that's her fault.
Yeah.
Well, Simone's leading you down the garden path. She got you in on cannabis first, the gateway drug, and now she's trying the hard stuff.
I got her into cannabis.
Okay.
And now she's doing the other way, and I've gone, oh God, here we go.
Yeah, strap yourselves in for that trip. But no, I was going to say, so I take it from what aside from the very helpful media attention from the Addy, but have you seen a real uptake recently in the number of appointments and the level of interest in people around the Geelong region who just would love to speak with you and understand what their options are for maybe a condition that they've been living with for a while?
Yeah, definitely, Andrew. I'm getting a lot more that since, thanks to the Addy that put my name down, they'll Google my name and they'll realise that I'm based in Geelong, and they might have been going to, say, clinics in Melbourne or interstate getting their medicinal cannabis and not really being understood, or how does it work, or what do I do? They've given me a starting dose, but then what do I do? And I've gone, you're supposed to be increasing it until you get the proper effect that you want. And then they'll say to me, well, what's the effect? And I said, well, how long is this piece of string? Because everyone's so different. You don't know really. There isn't a limit to what dose suits one person over another one.
Yeah, no, absolutely.
But, in my private practice, I think it used to be half. Now I'm going 3/4 medicinal cannabis clients compared to only 1/4 now of diabetes.
Wow. It's goodness me. The really the damn wall has broken.
Which is good for us.
Yeah.
For us prescribers, and getting people onto natural therapy that is brilliant, and it should have been around a lot longer.
And I should say as well, and I'll also heed your advice, Mitch, to not name any names of companies charging extortionate prices. But I do hope that with just the larger amounts of people that move into this space, that, you know, it sort of becomes untenable for those companies to continue, you know, putting out their products at those prices, because, you know, we know there's a lot more competition now in the space with products that are available, and ultimately we want to see patients to whom, you know, this medicine provides a real difference in their quality of life, being able to afford those medicines. So a bit of a watch this space, but it's kind of exciting after, I mean, going on nearly, you know, 6 years or so since it was first legalized in Victoria, that, you know, we've finally, now it does feel like the dam wall is broken. It's okay to talk to people in the street or with anyone about this as a medicine. You know, the stigma's starting.
I think, Andrew, since COVID has done it.
Yeah.
It's when COVID was about, that's when all of a sudden people were able to, and the lucky enough in Victoria, Vic Health, the minister at that stage just said, right, we need to get situations fixed up. So then she actually gave us the legal thing to start prescribing.
Yeah.
So we were
removing, you know, S8 permits and all that.
Yes.
Stuff. Yeah, exactly. No, very, very proud to be Victorian when I hear things like that.
I am, because we're the only state that nurse practitioners can prescribe.
Yeah, exactly.
I didn't know
the
that.
Other states can't. So we're the up ones in the Australia that don't have a problem. There's some states that will allow MPs just to do S4s, but Victoria allows us to do everything.
Wow. No,
Didn't know that either.
Yeah.
See, Mitch, you're privileged with working here in Victoria, and us MPs are allowed to do a hell of a lot.
Yeah,
absolutely.
That's what the Altmed podcast is all about, Mitch. It's just about shared learning. So good to have you.
Yeah, I'm just doing it so I can learn some stuff, to be honest.
Olga, it's been a pleasure. Thank you so much for joining us. I love the work that you're doing. Love the fact that the practice is booming, and obviously with the scarf that you're wearing, very proud of what your cats were able to achieve recently.
Well, saying that, Andrew, I do sponsor one of the young boys, so I'm very...
Yeah, you are embedded in that club's DNA.
Yes, definitely. Yeah, not a problem. But thank you guys for allowing me to talk with you.
No,
it's been a pleasure.
Yeah, and we'll keep in touch, and until next time, take care.
Will do. Thanks, guys. Thank you very much.